the most dangerous thing about microneedling pens at home is if you don't know what you're doing, you don't have a feel for what's supposed to feel like, you can tear your face up.
Yes. Yep. Which is exactly why I waited. I've had that thing for probably about 18 months and I'm like, nope, I don't want to do this wrong.
You can, when you get good at it, you can start to feel it dragging and all that stuff. But if you don't know what you're feeling, it feels really good. It's dragging, it's tearing, it's going to resurface my skin, and then scars.
Yeah. Yeah. You definitely have to know what you're doing.
Welcome to the Longevity Unlocked podcast. We are your guide to optimizing your life one health tip at a time. We are not providing a replacement for medical advice. Please always consult your doctor before making any diet, exercise, medical, or lifestyle changes.
Ladies and gentlemen, welcome to Longevity Unlocked. I'm Dr. K here with Allyssa LaScala, or Biohacking Bombshell on Instagram. Today we're going to talk about beauty toxin loads. We're going to talk about alternative methods that are much safer for you to do. We're going to talk about why she got into this field. Let's get into it. We're missing Coach Kyle. He's somewhere not here. We won't say where. We have a very special guest today, Allyssa LaScala, integrative health practitioner. Thank you for joining us.
Thanks for having me.
So you're here. You guys flew down actually to see us in the practice. You had a few treatments done on yourself. You want to open with what you flew down for and why you did it?
Yeah. Yesterday I got a lot done to my face, my neck, my chest. So if I don't know how I look on camera, but I definitely feel a little rosy, and a litlittle bit slightly inflamed as my body's responding to the PRP to the face, which was the first time I ever got it. I've been thinking about doing it for years, but I know the level that you guys go to for, just like the cleanliness of the procedure and the post-procedure type of care, that it's a really easy way to introduce toxins into your system if you go to the wrong person. And I greatly respect what you guys do in your practice. So I was excited to come here for it.
Yeah, thank you. So let's start by, do you mind if we detail what you had done?
No, let's go for it.
Okay. So do you want to talk about it? Do you want to explain from your perspective?
Yeah, I got a combination of PRP and stem cells to the scalp yesterday, help with some hair growth, to go and get it to my face, to my neck, to my chest. We did some microneedling along with that as well, put exosomes on top at the end. And so essentially, I just know way too much about Botox and filler at this point, standard filler. So I will take basically any measure possible to go into things the safe, natural way. Yeah.
So why don't you like traditional treatments, Botox, filler, all that stuff?
As I went down the rabbit hole, primarily for Botox, and then filler, I feel like is like the lesser of the two evils. But the risk just, for me, you just can't outweigh the reward. It is one of those things that you can't actually chelate from the body. So if you start to have any type of botulism, you're kind of stuck with it. And I've just seen way too many cases of 4 years, such extreme dysfunction, and it will wreck someone's life.
So there's been studies, they've taken patients that haven't had Botox in their face in years, and they'll do spinal taps on them, get spinal cord fluid, and there's botulism in there. So your body doesn't eliminate it. It shifts it around the lymph, but it can't figure out how to dump it.
Yeah, that's one of the top myths is they'll say it doesn't cross the blood-brain barrier. It does not travel systemic outside of that area. It's wearing off anywhere from 4 to 12 months. I'm like, no, that's new synapses that are growing. That's not a wearing off. And yes, it does spread.
And so I know why I don't like filler. Why don't you like filler?
The impairment that it does mostly to lymphatic drainage is clearly going to be the biggest thing there. They've clearly seen on MRIs that it could migrate to the brain. And then when you're looking at any foreign substance, especially when you're dealing with types of clients that we work with, it can create an autoimmune response.
And for all those people out there that don't care and say they want to look really pretty, pillow face, Google it. Do you know what I'm talking about?
I don't know if we're thinking of the same thing. I've heard that used in a couple different terms, so elaborate.
It's that filler over time, because it sits there, it tends to absorb water, and face starts to just expand. That's why all those celebrities are getting taken out now.
Yeah, and if you end up trying to do any of the dissolver, so some will be surgically removed depending on what type of filler you do, right? And then the dissolver, if you're going and trying to dissolve the filler itself, people don't realize that it can actually dissolve areas of your other tissue as well. So you just kind of cross your fingers and hope for the best.
So that's why natural treatments. So let's talk about what what natural treatments you recommend overall, from stuff people can do at home to medical services you have to go somewhere for.
Yeah. From what I've learned so far, I do think that microneedling is one of the most powerful things. I did wait, even though I have my own microneedling pen at home. I was telling Liz yesterday that I wanted to get it done first so I knew what it felt like and I felt more comfortable doing it. But that will start to become something that I am doing on a monthly basis at home. And it's relatively inexpensive to do.
Yeah. The most dangerous thing about microneedling pens at home is if you don't know what you're doing, you don't have a feel for what's supposed to feel like, you can tear your face up.
Yes. Yep. Which is exactly why I waited. I've had that thing for probably about 18 months and I'm like, nope, I don't want to do this wrong.
It's, you can, when you get good at it, you can start to feel it dragging and all that stuff. But if you don't know what you're feeling, oh, it feels really good. It's dragging, it's tearing, it's going to resurface my skin, and then scars.
Yeah. Yeah. You definitely have to know what you're doing.
Okay. What about, what else can people do at home?
As far as the different experimentation that I've done with any type of more comprehensive therapies, the microneedling is as far as I've gotten. I've definitely experimented with a lot of different skincare products, but I'll do gua sha. I'll also do face taping. That's probably one of the most recent things that, again, people kind of think it's just like frownies. They hear it's like tape or a sticker and you slap it on, and it's actually not. You're using kinesiology tape to specifically stretch out the muscle and the fascia. So it definitely takes strategy as well. And I think that while it's very meticulous and annoying for some people, when you are adamant about making sure that you don't do Botox or filler, that is also one of the most inexpensive at-home therapies.
So both PRP microneedling, it is very good for your skin health. It's good for resurfacing your skin, but it's not as strong as Botox or filler.
Yes.
So I mean, I know what we're doing now. What do you suggest for people to do?
Well, I am continuing to go down this rabbit hole. So laser will be the next thing that I do. It was definitely very evident in your NP esthetician that you have that. I was like, how is it that you haven't gotten Botox in years and your skin looks that great? And that's why.
So what we're talking about, we're bringing two new services into the practice. One is a CO2 laser. It's amazing for resurfacing the skin, but it can go deep and really break down the root cause of wrinkles. The other thing we have, it's called derma, and it is PRP filler. So we actually take your own blood, we basically create a gel out of it, and we inject it into your face just like you would filler, but it's not toxic, it's your own blood. And this will last 8 to 12 months.
Yeah. I did not know about that until yesterday. I had heard about things and I'm like, there has to be some catch. There's something else they add to it.
There's no catch.
So I will tell you, I am strongly considering that. I'm really excited to hear that that's available.
It's basically the same concept as like cooking an egg. You cook an egg, it becomes that, you turn from gel to white protein solids. Same idea. We're doing that with your own blood. We're creating that gel.
Yeah, that albumin is incredibly used there. I mean, she was even saying that she's done some breast lifts or butt lifts with some of that. That's wild.
So breast lifts, butt lifts, they take a lot of blood, but they still tend to look really, really good. Similar to doing a fat transfer, but nowhere near as invasive. It's a blood draw instead of liposuction, and then a small needle instead of the fat cannula they have to use for fat transfer.
Yeah. Wish I would have known about that before I went for fat transfer. I still do not regret doing it, but it's really neat to see the less invasive procedures coming out.
So that's that's what we're offering. Tell me something else interesting. Your favorite topic?
My favorite topic. I think that Botox and filler are definitely my favorite ones to touch on there. I always, when I'm talking to people about this, run through the myths. One of my favorite fun facts about Botox, because I feel like it's been so glorified, especially in the longevity space of you're just looking younger longer. And they don't realize the atrophy. They don't realize the systemic effect. They don't realize that when it's measured in the LD50 unit, what does that stand for? It's a lethal dose 50. So lethal dose for 50% of mice. And people are like, estheticians will argue with me and say that's not true. And I'm like, you don't know your own product. You have to go actually look how the unit is measured. So just to talk about the severity of that, because I don't think that it's touched on enough. And a lot of patients are gaslit into thinking that it is incredibly rare when it's not. I think that we just don't have informed consent enough for people to actually recognize the problem that's happening. And it's not immediate. It'll even say in the black box warning label that this can happen weeks to months later. So that definitely is one of my favorite topics. But bringing further awareness to the severity of parabens and phthalates and PFAS and things like that that are in are beauty products that maybe someone's putting on after they spend a lot of money on these treatments, and they don't realize the effect it's having on their endocrine system, their fertility, increased risks of cancers. So a lot of those things that can be in personal care products, makeups, things like that, but also hair dyes, lashes, nails. So I have that conversation with clients all the time.
What are your top favorite brands that are clean and good?
I really like the One Skin brand that you guys use. I just found out about it. I've heard about it for years, but I'm very impressed with their products. As far as like very like mainstream but accessible, Clear Stem has been a brand that I would use. I really like Priya for makeup, Priia. So looking for non-comedogenic, I know that's not really a regulated term, but non-pore clogging ingredients is going to be able to work in tandem with everything that you guys are doing.
Awesome.
Yeah.
So can we talk about your skincare regimen? Like what are the core components of it?
Yeah. Definitely is a time commitment every day, but I realize I'd rather do that than have a dysregulated immune system from using alternative methods. So I will go and like at night before I go to bed, I'll typically do double cleansing with an oil cleanse and do a honey cleanse. I will follow that. I've been playing around with a lot of different products. I'll rotate in, a retinol at night, go and do an oil, go and do a really good lotion to lock in the moisture, let that sit for, 15 to 20 minutes, and then go and do face tape 5 to 7 nights out of the week.
Awesome.
So, yeah. And then in the morning, wash if I did the face tape. And then if not, I don't. And then I do the other skincare regimen in the morning, maybe like a niacinamide and an oil.
Very cool.
Yeah.
So as we know, beauty is both inside and out. So we've talked about out. Now let's talk about in.
Yep.
What are your main suggestions for people to do for beauty from the inside?
I think a lot of people are underestimating the importance of the fatty acids. So being on, and I'm talking like omega-3s, 6s, 9s, et cetera. I feel like everyone's just straight omega-3s and they don't realize that, for the lipid barrier, cell membrane health, things like that. So I like using a combination of those types of oils, but then also phosphatidylcholine. So different types of PC, and then making sure that you're getting in enough protein, amino acids, good electrolytes for cellular hydration. Those are the key components.
Okay.
Yeah.
Have you heard of Fatty 15?
Yes, I have. I have not tried it yet, but I've heard really good things.
So I've started combining that for patients. We use Dutch Harbor, so Dutch Harbor fish oil plus Fatty 15. So you're hitting more chains.
Okay. Yeah, definitely on my list of different things I want to try for sure.
So the next question I have for you is, what really got you into this space? What moved you away from traditional methods to really being so cognizant of toxins in the healthcare industry or in the beauty industry?
The beauty industry, yeah. As far as the influence on client toxicity loads, that was definitely an area that made me curious. Even just running a total toxic burden panel, being able to see the amount of toxicants coming out of the urine and then the impact that it's having on all of the systemic systems within the body, especially when you're dealing with clients with chronic health challenges. You have to start to get creative to say, if you've done all the things, how is this still here? And what impact is it having on you? So that's from like the clinical perspective, but my personal experience, I was really sick with what I ended up finding out later to be chronic Lyme, mold toxicity, extreme brain fog, extreme chronic fatigue. I could not function without Adderall and caffeine every single day. And so when I was trying to pull out all the stops to figure out how could I resolve this, because I had been doing things for years and nothing was working, I decided to get my implants removed at that time. And I'm always honest with people and with clients and say I had no resolution of symptoms with that. For me, I just needed to check it off the list. It didn't matter. I went into it being like, if this does no shift in symptoms, I reduced my toxic load. So that's fine. But, aesthetically, and I don't think it's a vain thing. I think a lot of women are pressured into thinking, it's not okay to like want to feel confident in your body and feel good. Clearly, you guys encourage that within your clinic as well and do it in a healthy way. So then I went and did fat transfer. And, as I was going down this rabbit hole to say, what are some of the other ways that we're still being exposed to toxicants that we're not aware of? I went down that from a like procedure perspective, but also personal care product perspective, because I think both angles are important.
Anything else you want to tell people?
I really love that you closed out with what you want to do internally. I think a lot of people are doing like one or the other and they miss both. Patience and consistency. I know it's a pain in the butt, but if you're going to go with these alternative methods, be willing to be consistent with it. Otherwise, don't get mad when the product doesn't work.
Yeah. Awesome. So with that, tell people how to find you.
We have our primary outlet on Instagram at Biohacking Bombshell is technically the name of my clinic and my handle, but you can find us on Facebook and on YouTube there as well.
Awesome. Well, everybody, thank you for joining us on this episode of Longevity Unlocked with Allyssa LaScala. We'll see you guys next time.
Thanks for having me.
This podcast is not medical advice, and any information taken from this episode should be discussed with your medical provider and not be a replacement for a consultation. We disclaim any responsibility for any possible adverse effects from information taken from the episode.